because we're all connected. I got the blessing of seeing that firsthand. Had a lady when I was practicing here on Pat Mill Road in Smyrna years ago. Lady with 4 kids, single mom. And the oldest one was a teenager who, he was like hit and miss. The other kids and the mom were regular patients. This kid was hit and miss. He was like there, not there, you know. And when I left to move to Arizona, it felt like I failed. That's the way I felt. I felt like I failed with this kid, right? Then my sister came to school, and she started working up here for Dr. Franks before she moved to Florida. And she gets this young man who comes into her office with his wife and newborn baby. So she goes to look at this, so what brought you in? What was the reason that brought you in? And the guy says to her, says, well, he said, when I was younger, we used to go to a chiropractor to say how important it was to get the kids checked. So I'm here to get my baby checked and my wife and me. We don't have any problems. She goes, who's your chiropractor? Dr. Rossi. And my sister at that time has, you know, her name is Hezwalker. Right? So that was my blessing from God to say, guess what? He did hear. He did learn. Another newborn baby was checked. Why? Because I didn't stop telling the story. Even when it felt like I was failing, I didn't stop telling the story. You got me? Because you look at that, and I know, I've had this too, when I say, like, I can't say it anymore, these people are not getting it, and I get all frustrated. Don't get it frustrated. Think about this story. Think about what's happening, that people are getting it. I have a lady right now. I love telling these stories. This lady's like, she's, you know the cartoon character Maxine? Yeah. Well, this lady's Maxine. They did the cartoon character after her. She's got this cynical thing and all this kind of stuff. So this year she comes in, really says, okay. She said, I'm putting it all on you. I said, what are you putting on me? This year I'm not getting a flu shot because you said what you said. I'm not getting the flu shot. So if I get the flu, it's your fault. I said, I'll take that chance. I said, but you understand, if you get the flu, that's because you probably overdid something. Oh, now you're getting out of it. No, you're probably not going to get the flu. She hasn't had the flu. Okay. And it's funny because this year, and she would do this every year with me. She would go on back, and I'm going to get the flu shot. And she just wanted to see what I'd say. I'd be subtle. Yeah, go ahead, poison yourself. That's fine. You want to poison yourself? Go ahead. Do these things like this all the time. Sometimes I don't know what comes out of my mouth half the time in the room. Okay, I had a patient, this guy named Phil, he's been a patient for years, and he comes in a few weeks ago, and he's going, Doc, I heard over here, I heard over here, I heard over here, I heard over here, and heard down here. And I said, Phil, why don't you talk to somebody who gives a shit? He said, well, where's the love? Where's the love? I said, it's right here. Okay, come on, Phil. All right, okay. You know, you got to know who to say that kind of stuff to. But you have fun. You talk the truth. Don't be afraid to be a little bit outlandish. Hell, I'm a lot outlandish. I've had people that just went nuts following me. I've had doctors follow me and, oh my God, you really said that to that person? Yeah, it's all right. You learn how to say things. You learn what to do. I had a lady one time who was in my practice, and she was fairly big-busted, and she was wearing a blouse. Okay, it was a button down the front blouse, you know, and I had to do the interior on her. And when I did the interior on her, 3 buttons popped off of her blouse. I don't mean came unbuttoned. I mean went flying across the room. Okay, and she looked down at herself, and then she looked at me, and I looked at her. I said, "Look," I said, "I've been trying to perfect that move for 15 years." And then she started laughing, and the whole thing became light with it. Okay, but you got to do that. Somebody passes gas when you adjust it. Hey, don't worry, as long as the paint doesn't peel on the walls, we're fine. Okay? Whatever you need to say. And by the way, when someone does that, don't ignore it. The worst thing you could do is ignore it. You got to say something. Because if you ignore it, they go out feeling very self-conscious, not knowing, do you hear it, do you smell it? You say something. all times with that, okay? So, I don't know how to go on that, but that's part of building faith and understanding. And have a little faith in yourself. Have a little faith that you're going to say the right thing when the time comes. Okay? Lots of people go into practice, young doctors and stuff in practice, with all this fear, because what if the person asks me this? What am I going to say? Have some faith that it's going to be, that God's going to set up exactly what you need. Okay? I had that fear. I had that fear. I don't know what I was going to say. Well, for those of you who are back here when I first taught at Life College, besides teaching technique, if you remember, I taught visceral diagnosis and I taught endocrinology. Okay? So I understood that stuff. Okay? Doesn't mean everybody thought that I did visceral exams in my office because I taught people about it, but I didn't do that. Okay? But that was part of it, right? So I'm in an orientation one night, and this lady brings her husband through, and there was like 16 people at this orientation, another big one, right? And she brings her husband, which I want them to bring their spouses, right? And the husband's in the back, you've seen this, like this. The whole time. There's no smiling. Just sitting there. Just pissed that he's there. Right? After the orientation, I always have open for questions. This guy shoots his hand up. I knew it was coming. The guy goes to me and says, well, I happen to know something about the endocrine system. He said, and I know that the endocrine system controls all the functions of the body, not the nervous system. So now I had a choice right here in my own head. Either be kind of mealy-mouthed with him and risk losing everybody else, or just blow him out of the water and then save everybody else. So I chose to do that. And so I said, oh really? I said, well, what's the major gland in the body? He goes into the pituitary. I said, are you talking about the anterior pituitary or posterior pituitary? Well, the pituitary. Okay, good. Because the anterior pituitary is controlled by releasing factors from the hypothalamus, which is controlled by the nervous system. The posterior pituitary has direct nerve endings from the hypothalamus to the posterior pituitary, which controls the posterior pituitary. Either way, it's controlled by way of the hypothalamus, which is your major control center of the nervous system. So you're wrong. Okay? Well, the guy left. He never came in. But everybody else was fine with that. Okay? And I stopped to think about that. If that was a question about the vascular system, I couldn't have answered it. But what God sent me was exactly what I needed. And all the studying I've done in endocrinology for all the years was exactly what I needed to handle that situation. And it always happens that way. It always happens that way. So have faith that you're going to have the answer when it's needed, because you always will. You always will. Okay? Someone asked me when I spoke last, what's probably one of the better lines that I use in the office? And I tell them very easily. It's a very easy one for me. If you're alive with nerve interference, doesn't it make sense you'd be better off without interference, whether you have symptoms or not? If you're alive with nerve interference, doesn't it make sense you'd be better off without interference, whether you have symptoms or not? Well, the person would say, no. Of course they say yes to that. Of course they do. Who wants interference? I want interference. No. Isn't that what we do? So why are we treating symptoms? Why are we treating diseases? Because that's what people expect. People expect immunity from vaccines too. It doesn't work. It's up to us to educate people. Okay? No, I'm not here to treat your symptom. I'm here to remove interference, to allow your body to be more of you, to get you're connected to spirit better, and from inside out, your body's going to take care of itself. Whatever it needs to do, it will do. And I'm going to get out of the way. Okay? Was that so hard to say? Is that so hard to do? Not hard at all.